Thank you for visiting Dr. AFib. I'm Dr. Morales. In today's video segment, we're going to be talking about atrial fibrillation and congestive heart failure together. February is Heart Month, and so I wanted to make some videos where I discuss not just atrial fibrillation, but how atrial fibrillation affects other heart conditions and looking at your heart as a whole. And so in this segment, we're going to be talking about atrial fibrillation and congestive heart failure, which is commonly called CHF. CHF can refer to a few things. Most commonly, it's referred to a weak heart, but it can also be referred to as a stiff heart. In either circumstance, the heart just doesn't pump blood efficiently to the rest of your body and leads to backflow, which can lead to fluid in your lungs or swelling in your legs, which are the most common symptoms of congestive heart failure. So how does atrial fibrillation affect congestive heart failure? Well, there's two ways that it can affect that. One, it can be the primary cause of congestive heart failure, or two, it can be secondary because of congestive heart failure. So let's talk about the first one, which is atrial fibrillation is the cause of congestive heart failure. Sometimes when patients are first diagnosed with atrial fibrillation, they don't necessarily feel the heart going fast or skipping. They just start feeling more short of breath. And so when they're finally diagnosed with atrial fibrillation, their heart may have gone fast for several weeks or even months at a time. And as a consequence of the heart going consistently fast all the time, the heart function becomes weak. It becomes weaker than normal. And in those settings, the atrial fibrillation is the cause of the congestive heart failure. Now, normally when they're first diagnosed, you have to do things like looking at coronary artery disease and making sure that that's not a cause as well. But if in the end it points to only atrial fibrillation being the cause of the congestive heart failure, that's what we call a tachycardia-mediated cardiomyopathy. And in these patients where the AFib is the sole cause of your congestive heart failure, there are a few ways to manage this. One is just making sure your heart rate is better controlled, and that over time can make your heart function get stronger again. However, rhythm control, which would be getting you out of atrial fibrillation, whether that be with a cardioversion or a procedure like an ablation, tends to work better to help improve your heart function and get it back closer to normal. And in some cases can actually bring your heart all the way back to normal function again. In some cases, atrial fibrillation is a secondary culprit. Your weak heart or your stiff heart puts a lot of pressure inside of your heart, increases the pressure inside of the bottom chambers of your heart as well as the top chambers of your heart, which over time makes them stretch and dilated, then ends up giving episodes of atrial fibrillation. In these settings, treating the atrial fibrillation is unlikely to make your heart function get stronger because it was a secondary culprit of the congestive heart failure. However, when people are in atrial fibrillation and they have congestive heart failure, I often tell people it's like you have a weak heart and the AFib just made it even weaker. And so people get more symptoms, they get more short of breath, more swelling in their legs. And keeping them in normal rhythm helps improve or maximize that little bit of heart function that they still have. And so treating your AFib with medications or with ablation procedures can also help improve that little bit of heart function that you have for people who have pre-existing congestive heart failure. Now, in both of these settings, doing a procedure can help maximize how much normal rhythm you have and improve your symptoms of congestive heart failure. However, doing an ablation procedure on somebody who has congestive heart failure can be an aggressive procedure, and it takes much longer for patients to recover an ablation procedure when they have existing congestive heart failure. So in these settings, not everybody who has congestive heart failure is a candidate for an ablation. And I certainly, when I have patients who have both congestive heart failure and are being prepared for an ablation procedure, you need to make sure that that congestive heart failure is tuned up as good as possible and that you're breathing as good as possible before you do the procedure. Because it certainly is a harder procedure for people to recover from who have existing congestive heart failure. But in the end, it can improve symptoms. And there was a recent article that I posted on my Facebook page that showed that people who have congestive heart failure and improve the amount of AFib they have with the catheter ablation, have less hospitalizations, and they can live longer. So there's certainly a benefit for patients who have pre-existing congestive heart failure as well. But it can be difficult to manage, and please discuss with your doctor to see if you are a candidate for ablation procedures, especially if you have existing congestive heart failure. Thank you for visiting this video segment of Dr. AFib. I'll see you next time where we'll be talking about atrial fibrillation as well as valve heart disease.